Hello, I'm Patrick Daly and I'm one of the team at the Rural Doctors Association of Australia. Each year, RDAA and the Australian College of Rural and Remote Medicine offer excellence awards that recognise some outstanding rural generalist doctors and some inspiring future doctors as well. I've been lucky enough to spend time chatting with our awards recipients for this podcast series. Today's podcast features Jas Singh, RDAA's Medical Student of the Year for 2022. As a student on the extended Rural Cohort at the University of Melbourne Medical School, Jas has undertaken all her medical training in rural areas since the second year of her medical degree. Along the way, she's also undertaken additional placements in East Arnhem Land and Cairns, and recently completed an elective placement at Tennant Creek Hospital. Jas originally planned to become a neurosurgeon, but soon realised that her real passion lies in rural medicine. She'll commence work as a medical intern in Cairns in 2023, following her graduation this year. I spoke with Jas in the lead up to this year's Rural Medicine Australia conference in Canberra. Before we begin, I'd like to acknowledge the traditional owners of the land we meet on across Australia as we listen to this podcast. I'd also like to pay my respects to elders, past, present and emerging, and welcome any Aboriginal and Torres Strait Islander listeners who may be joining us. Jas, congratulations on receiving the RDAA Medical Student of the Year Award for 2022. What did it mean to you when you found out?
It was a pretty big deal. I was over the moon when I found out because I guess as someone who's super passionate about rural health and rural health advocacy, and also sort of like stumbling into it, I sort of went into med school thinking I was going to be a neurosurgeon at Royal Melbourne Hospital, and I think, by being part of the extended rural cohort and moving from rural place to place, and I think getting a really broad and really interesting rural clinical experience as well as like exposure to just a heap of awesome rural communities, I think getting the RDAA Medical Student of the Year Award was a super proud moment.
So tell me about your childhood. You were raised in a rural location?
Yeah, not so much rural anymore, but I was born in Nambour on the Sunshine Coast in Queensland, and I grew up on a little macadamia nut farm in a little town called Diddillaba. So I grew up there, went to school at a little place called Woombai State Primary School, and then did my high schooling at Nambour State High School. So I'm a Queensland girl who has come to Victoria.
You didn't end up in macadamia farming?
No, I can tell you a lot about macadamia nut farming, but it's not where my passion lies, though I do love macadamias, I must admit, yeah.
So look, what got you interested in medicine?
So it was a few experiences and I guess a few things falling into place for me. I think in high school it sort of started with probably back in year 9, one of my teachers offered me a position on a program called the Star Young Leaders Program back then at Nambour. And so that involved essentially like learning a little bit about leadership and becoming involved in the community. And one of the aspects of the program was volunteering at the local children's hospital. So I was like, sure, let's do it. And started going to the children's hospital once a week where I sort of help out in the schoolroom, help kids with their, like whatever, if they had if they were missing out on school, you help them with whatever homework they had, or I'd be doing some arts and crafts with them, or sometimes, parents would need a bit of a break from the children's ward, so I'd go hang out with the kids and play board games or just have a chat. So it was quite variable, but I really enjoyed, I guess, being in that hospital environment and seeing the doctors and the nurses and allied health teams all working together with families and patients to help better the kids that were on the ward at the time. And
had you thought about medicine before that point?
Not really. I think I was just sort of, just enjoying being a kid and playing sport and working on the farm and hanging out with mates. I guess I didn't really start to think about what I wanted to do beyond school until I started, doing a bit of volunteering in the hospital, and I guess enjoying the sciences and maths a bit more, and having that curiosity about, medicine, and that came a bit later, I think.
And that added to your interest in pediatrics as well?
Yeah, definitely. I really enjoy working with kids because babies all the way through to adolescence, they can be so different, and you have to really adapt your approach. And I think because I have a particular focus on public health and health literacy and health advocacy, and I think that a lot of your habits that you sort of hold on to later on in life and adulthood, you sort of establish early on. So I think working with kids and in pediatrics is definitely a space I'm interested in, because you can definitely have a huge effect on people's lives.
So once you got an interest in medicine, was it then a natural progression into rural medicine based on your location and background and time at Nambour Hospital as a high school student, or did that come a little bit later?
Looking back, so I guess I actually left Nambour to move down to Melbourne because I was looking for a change, and I'd grown up in a small town, was going to see how I cope in a big city, and so
see how the macadamia nuts were in Melbourne.
Yeah, I made sure Mum sent down bags of them to keep my craving at bay. So I was actually thinking that I was going to stay in the city. I really enjoyed living in the city, but I think once I embarked on my first set of rural clinical placements, which was in my second year as a medical student, I think I realised that I was drawn to the country. And I think as you get a bit older, you sort of I'm still a baby, but I think I don't know. I feel like I've realised that I am a country girl at heart, and I think I've realised that by going out to rural Victorian communities and doing a placement there.
Yeah, tell me about those placements, because you've been part of the extended rural cohort at Melbourne Medical School, and part of that is going out into rural placements and also undertaking, I think, 6 months in general practice.
Yeah, that's right. So with the extended rural cohort at Melbourne Medical School, you are rural from the get-go. So our clinical years start in second year. So I've been rural since my MD 2 years started, and I started off in Shepparton at Goulburn Valley Health Hospital. And then I've done placements in Wangaratta, Echuca, Ballarat, and I'm currently in Bendigo. And along the way have elected to do placements in Cairns and East Arnhem Land in the Northern Territory. So yeah, I've moved around a lot.
So what have been the highlights of the rural placement so far?
Oh, the highlights, that's hard to boil down. I think it comes down to, I guess, one, the sense of community that I've gotten from being in various rural towns. So I think I've found that through, the workplace culture at the hospitals, as well as a sporty gal. I always join the local soccer team or try different sports. For example, in Shepparton, myself and a friend, Indy Barrow, she was actually the 2021.
Yes, indeed, that's right. Yeah.
So we actually joined the local rowing club and ended up rowing at the state championships for the Shepparton Rowing Club. Right. So I think I've definitely found a sense of community, and also the second part I've probably loved the most is the variety. I feel like in rural medicine you get exposure to all different sorts of things, and it's quite a balancing act. You often dealing with, sometimes complex social issues, challenges such as geographical isolation, and, sometimes late presentations and some issues with health literacy as well. So there's a lot to unpack, and it's a challenging but really interesting space, I think, to work in.
Do you think you would have ended up on a rural medical pathway had you not been on that extended rural cohort and starting your rural placements so early in your degree?
Yeah, it's an interesting question. I've also been thinking about that, and honestly, I'm not sure, because I feel like when I was living in the city, I was so caught up in the hustle bustle and was like, maybe I'll just stay in the city and we'll see what happens. But I think once I moved to the country, I feel like I developed sort of like a deeper understanding of medicine, and I guess a lot of things such as like the biopsychosocial model, which I think we need to incorporate a bit more into our practice. So I think upon reflection, I'm really glad that I've gone down the rural pathway, because I feel like if I didn't have the opportunity to be at BRC, I potentially wouldn't have realised that I have a real passion in rural health.
Tell me about your John Flynn placement. So, As I understand it, you undertook two, one in the Northern Territory at Govan Nullumbi, and also one in Cairns. Interested in hearing a little bit about your experiences there, and also what you took away from those placements.
Yeah, so my John Flynn placement in Nhulunbuy was an incredible opportunity. So it was actually a bit of a tricky time when I went because COVID had just hit. So I really fought for going to the Northern Territory, and it ended up there, thank goodness, because I had a real curiosity about remote medicine and working with remote Aboriginal communities. And I know that East Arnhem Land caters to a lot of remote Indigenous communities up there. And I think that particular trip helped me develop a deeper appreciation for our First Nations people in terms of their culture, the communities, kinship systems, the medicine and understanding of the land. I think I learned a lot about up there about particularly the Yolngu community. And it was, such an incredible trip in terms of the learning that I got. So I learnt a lot about how Aboriginal medical services run up there, and also about the diseases up there. I felt like I was starting from scratch, to be honest. Like the medicine that I was exposed to down in regional Victoria versus remote Northern Territory is like chalk and cheese. So I learned a lot about things like acute rheumatic fever, rheumatic heart disease, scabies, and carbuncles, stuff that I didn't even know what they were until I went up there.
And what about the challenges involved in delivering healthcare in those settings as well? What did you come back having learned about those?
Yeah, so I think I've learnt that it's so important to understand the cultural context in which you're working. I think we sometimes, as doctors in particular, can get a bit carried away with the medicine, like the pathophysiology of this condition and the management of this. Like there's so much more to it, and I feel like I developed a greater understanding of all the different factors that you need to think about, such as cultural context, such as respecting geographical location and language barriers. And, for example, up in East Arnhem Land, sometimes English was people's fourth, fifth language. So, being able to learn a bit about the language and using body language, and you have to rely a lot on your communication and rapport skills. And I think that particular placement in East Arnhem Land definitely opened my eyes to the importance of all the other factors aside from the pure medicine that really affect people's overall health and health outcomes.
And what about Cairns? Because I'd imagine that would have been a different sort of placement for you.
Yeah, so my Cairns placement, so it was a bit shorter than my East Arnhem one. So I think it was definitely a different context. I feel like Cairns is rural, whereas Nhulunbuy was definitely remote.
Yes.
And I still got, similar exposure to Indigenous medicine, but also there was a lot more tropical disease. So things like, milia and parasitic infections and things that I hadn't really seen before. So that was also a really interesting experience. And also Cairns is such a beautiful part of the world.
Absolutely.
I think that's why I'm heading back up there. got more to explore. Yeah.
And I guess in terms of settings, Cairns would have had a better tertiary level support as well, which would make a difference in terms of the treatment that you were able to provide locally.
Yeah, absolutely. When we were in East Arnhem Land, we relied on specialists to come in, once a month or once every couple of months, and the rest, the rural generalists were running the hospital otherwise. Whereas in Cairns, there's a lot more services and a lot more access to specialists and specialty care. But in saying that, like the rural generalists that I worked with at East Arnhem Land had an incredible level of skill set, and their breadth of skills was so impressive. And I think it was one of the really inspiring experiences that I've had that have, I guess, sparked that interest in the rural generalist pathway.
Yeah, tell me a little bit about that, because prior to that placement, I'm not sure whether you were thinking about rural generalism as a career option, but as I understand it now, you are. What did you take away from that placement that really triggered your interest in rural generalism that you hadn't thought of before?
In all honesty, I didn't know what rural journalism was until I actually went to the NT. And I think what it was for me was I'm someone who likes a lot of variety, like in my life, I like sport, you're spending time with friends and family, working, doing random experiences, going hiking, yada, yada, yada. So I think for me, I also like that variety within medicine. So I think even though I'm quite, interested in pediatrics and women's health and critical care, I think For me, variety is a big thing, and seeing the rural generalists at Grove District Hospital work and be able to manage, women's health cases and pediatric cases, and then help out with a general surgical case, and then be able to manage anything in the ED. That was very, it was a big wow moment for me. I was like, wow, they know how to do so much, and they have such a broad range of skills. I really want to be able to do that to help as many people as I can.
Now, for your final year medical elective, you've organised to undertake later this year an elective at Tennant Creek Hospital, which is again in the remote Northern Territory. What's got under your skin about the NT, and what do you hope to take away from this placement?
So the NT has really stuck with me. I think that I'm so grateful that I really pushed for that experience up in East Arnhem Land, because I think it has honestly changed the trajectory of my life, to be honest. I think I really caught the rural/remote bug. I think it was, I am drawn to, beautiful places, and, a lot of rural and remote areas have beautiful hiking spots, camping spots, and there's a lot of, as someone who loves all that sort of stuff, seems like the perfect place to go. And also I really enjoy the rural lifestyle, and I guess as someone interested in rural generalism, I feel like the NT in Queensland in particular are sort of the heart of rural generalism. And I think, I guess the experience that I had and the fact that it was so hands-on, there was so much variety, I met such cool people. I think that's what sort of drawn me to the NT and Far North Queensland. I feel like those sort of areas attract people who are very similar to me, who like the outdoors, who are quite laid back, who like a bit of variety, can be flexible, and I guess that's what's drawn me to the NT and Far North Queensland.
You've also took a 7-day trip to the top end for the annual NT Primary Health Network High School to Health Careers program. Tell me about that.
Yeah, that trip was incredible. I'm still coming down from the high of that trip. I miss it. So I wish I was back in the NT. So this trip was a really good opportunity for me to learn a bit more about the nursing specialty and allied health teams as well, because we were a multidisciplinary team. So there was 2 medical students, 3 nursing students, and a speech pathology student. And we went over to the top end and delivered health education workshops, as well as had chats with students in Catherine and Darwin about careers in healthcare in an attempt to sort of, I guess, get people excited to enter the rural and remote health workforce. And I think this trip was such a good combination of exposure to the NT. So, for example, we spent a few days going to Burunga Festival, which was in a remote Aboriginal community up in the top end, where we got to experience a bit more Indigenous culture, learn about bush medicines, and watch traditional dances. And it was, again, a really good opportunity to learn more about our First Nations people. And I think we, as a nation, need to do a lot more to embrace and learn more about our First Nations people, communities, and culture, because it's such a beautiful, beautiful thing. And I think the trip really, again, highlighted that. And also, I guess, working within the multidisciplinary team, I learned a bit more about, how nurses and allied health people sort of, how we all work within the hospital system. And so it was a really good trip for that. Yeah.
And in terms of the local students there, is there more self-belief, do you think, now that local students, First Nations students, can go on to rural health careers? Do you think there's been good marketing around that in terms of encouraging local students to get involved in the health profession?
Yeah, I think particularly the NT Primary Health Network is trying to do a lot to get students into the healthcare field and, want to stay rural and want to work within the Northern Territory with things like the High School to Health Careers program. And also, as someone who's been part of rural health clubs ever since I became rural in second year, I have realised that, all the rural health clubs have a team dedicated to high school visits. So I think not only is the Northern Territory trying to do that, but also all the states are trying to encourage high school students to want to pursue rural health careers, which is really awesome. Like, for example, through Outlook Rural Health Club, which I'm president of this year, our awesome rural high school visits team have organised high school visits in Wangaratta, Shepparton, and we've expanded to Ballarat this year as well. And the other health clubs are covering other areas. So it's really good to see, as someone who's caught the rural health bug, I think, spreading the word and getting people excited to be rural, I think is important to me.
Now, on your placements, you would have been exposed to a lot of different areas of medicine. Are there some areas that you didn't think you'd ever be interested in, but you've come away from your placement thinking, oh, actually, that's quite an interesting area that I might actually pursue further down the track?
Ooh, interesting question. I think as someone who went into medicine wanting to be a neurosurgeon, I think, and that was all I wanted. And now I've realized that there's so much more that I'm interested in. I think, for example, when I did my women's health rotation in obstetrics and gynecology, I absolutely loved being at the Women's Health Centre and being involved in deliveries and providing, preconception counselling and antenatal care, and being part of that process. I was really surprised by that. I guess because I was so set on surgery. Any other rotation that I enjoyed, I was like, oh my god, there's more things that I like outside of surgery. So I'd say there's not many rotations that I haven't enjoyed, to be honest. Yeah.
Which probably makes you a perfect candidate to be a rural generalist, I suspect.
Yeah, I know. So all the pieces are falling into place.
Absolutely. So what have been the key impediments for you in training rurally? It sounds like you've had a pretty organised sort of placement run through your medical degree, but have there been any impediments you've come across that you think could be done better system-wide, health system-wide?
Yeah, I think obviously a huge impediment for me was the COVID pandemic. We unfortunately were taken off placement, and it was quite an interesting time to be a medical student. I guess we were getting mixed advice from the health department, the hospitals, our clinical schools. So it was tricky to, I guess, make the most of placement whilst all these policies were changing, all the rules were changing, and there was other factors that affected my professional life, such as being isolated from family who were up in Queensland. So I think it was a challenging time, I guess. As a health system, I think what we could do better is, being a bit more centralised. I think, for example, in Queensland, they've got a centralised healthcare system, which is brilliant, whereas in Victoria, I know we're sort of working towards that, but it's not really happened yet. I think just having that communication between hospitals and allowing, movement between hospitals would be really good. And also, I know students sometimes struggle moving from hospital to hospital. You have to sort of learn the whole system again. So that can often be quite a challenge. But I think overall, what I've learned is that no matter where you're placed, you have to make the most of your experience. And no matter what people tell you, I think I've realised that your experience is your own and what you make of it. So I think, for example, I heard mixed reviews about various hospitals, but I've enjoyed literally every placement that I've had and have. I think that comes to your attitude, your adaptability, and also your resilience, I think.
Now, apart from your medical studies, you've been involved in a wide variety of other projects with a rural bent to them often. You're currently chair of the Rural Surgical Students Society of Melbourne. Tell me a little bit about that role and what it involves.
Yeah, so I've got my fingers in different pies, so I'm still keeping my surgical interests up. So this year I've been lucky enough to be the rural chair as well as the president of the overall Surgical Society at Melbourne. And this role has sort of involved running a rural surgical mentoring program, which I've tried to keep it quite loose this year just to allow mentees and mentors to sort of, I've sort of connected them and then checked in throughout the year. And the aim of that was sort of to get students who are interested in surgery to have a bit of a mentor to provide advice, bounce ideas off, and just, shadow them and learn a bit more about the surgical field. So that's been one aspect. And also I guess metropolitan areas are notorious for surgical research. We've also tried to improve accessibility to surgical research in rural areas. So over the years, because I've been involved with the Surgical Society since my second year, we've tried to establish research opportunities for students as well, which I've personally been involved in, as well as gotten other students involved in. And the last part is of being chairs involved organising workshops, so particularly suturing workshops, plastering workshops, and surgical teaching across the sites through our awesome subcommittee. And yeah, so it's been a really, really good way to keep up my surgical interests alongside all my other rural health interests, and also to stay a bit connected to the metropolitan clinical schools as well and bounce ideas off each other. And also, I guess, provide a bit of input, because a lot of our big events are in the city, about, making them accessible for rural students as well. So we tried to do more events online or in a hybrid setting, and try and run some events in rural settings as well.
Tell me about the possum skin cloak project as well that you were involved in.
Oh, this was incredible. So I was working quite closely with Auntie Cynthia, who's the Arlo at Goulburn Valley Health Hospital, and she actually introduced me to Auntie Leah, who was running the possum skin cloak project. And it was so we were making these possum skin cloaks for the Cancer Centre for patients who were Aboriginal or Torres Strait Islander to wear whilst they were getting their cancer treatment. And for me, this was an incredible opportunity to learn a bit more about the local Yorta Yorta community. And I was very mindful, as someone who was going in as a non-Indigenous person, of just really wanting to listen and help and learn. And so going to what it involved was going to a heap of workshops where we the elders led the sessions and taught me how to sew the cloak, and I helped to do a bit of the art on the cloak, which was incredible to be involved in. And I guess I just learnt a lot about the community, and I guess a lot of the struggles that Indigenous people have faced, with policies that the Australian government has had in place, and a lot of discrimination that communities face even now within our healthcare system and society in general. And I think it was a really eye-opening experience where I learnt a lot about that sort of stuff, and also about the strength and resilience of Indigenous people and the beautiful culture. Like learning about the possum skin cloak was awesome, and being able to help make one was out of this world. And I'm really, really grateful to the community for letting me be part of that, and particularly Auntie Leah and Auntie Cynthia for getting me on board.
That sounds fantastic.
Mm.
Now, you've done way too much. There's way too much to try to fit into a 40-minute interview. But I'm interested to hear about the Kenyan Village Medical Education Program as well that you're involved in. Took you away for some visits to Kenyan communities, I believe, where you were helping local residents with health education. Am I right?
Yes, that's right. So as I mentioned earlier, as someone who's quite interested in health education and advocacy, when I stumbled upon this project back in 2017, when I was a little biomed baby, I was super keen to get involved. So what this program is, it's actually a student-led initiative that was started by a couple of medical students years and years ago now, I think back in 2008. And the program has changed so much since I joined in 2017, because obviously, we've been through COVID, and we've tried to develop our model to be, community specific and culturally safe. And we're trying to get more partnerships over in Kenya to better inform our program and improve the program's outcomes. So back when I joined, we went over to rural and remote Kenyan communities, and we had a Kenyan coordinator and various partnerships that helped inform which communities to go to and what sort of conditions to discuss. And we also had a translator, because we're going to different communities that spoke different languages. And so we would prepare presentations on things like pneumonia, to first aid, to heart disease, and So we covered a breadth of topics, and they were dependent on which ones were relevant to the community. And we would have all of our presentations translated, and then would have community members ask us questions at the end, would leave behind translated pamphlets and information sheets, and also sit down, have a cup of tea, and get to know community members. And we made an active effort to learn a bit of Swahili, to be able to have some conversations as well. But most people, spoke a bit of English as well, so we came to a middle ground. But this program was an incredible opportunity to learn, I guess, about global health and public health, as well as, I guess, rural and remote health in a different cultural context. And it was also a great way to, work within a team in a not so easy setting. Sometimes we were going to super remote areas, or things wouldn't go to plan, or we were on one trip, there was 6 of us girls in one room, and it was a tiny room. So it was definitely a very hectic experience, but it was very rewarding in that I learned so much, again, about working in a cultural context and things to consider, as well as learning a bit about a healthcare system outside of Australia. It's like Kenya's healthcare system versus Australia's, very, very different. So it was a very rewarding experience.
You'll soon be a first-time author. You're publishing an article in the Journal of Pregnancy and Childbirth. Can you tell me what the article's about?
Yeah, so I have been working closely with my clinical supervisor, who is a pediatric cardiologist. And so as I mentioned, I'm interested in pediatrics, so I chose to do a pediatrics project for my research project through Melbourne Uni, and I've sort of taken that with my supervisor to beyond, I guess, my research project within the uni, and we're writing a paper on the Snow Smart Sleeper, which is essentially a device used for improving infant sleep, particularly in the first 6 months of life. So at the moment, I'm doing a literature review looking at what research is available on this Snow Smart Sleeper, which is, I guess, becoming a bit more popular, and also being used in different contexts, not just for improving sleep in kids, but also for settling crying infants. And for example, there's a study happening on using it for kids who've had like a heart surgery and a post-op, and helping settle them. So yeah, it's been an interesting project. I've learned a lot about infant sleep and the Snow Smart Sleeper, and also just learned a lot about the research process. It is quite an arduous process, and I've been writing drafts and getting them edited, writing more drafts, getting them edited. And so yeah, hopefully I'll be able to publish later this year, but we'll see how we go.
Yeah, right. Have you undertaken other research as well, other research projects while you've been at uni?
Yeah. As I mentioned, through the Surgical Student Society, we've been trying to expand on our research that's available in rural settings. So, for example, I was involved in the opera study, which was conducted in Ballarat. So I led the orthopedic team, and was organising for data to be collected on patients at Ballarat who are undergoing orthopedic procedures. So that was one research program that was
What did that involve?
So that was looking at analgesics used in post-op patients. So we were doing follow-up to see how patients were going with the analgesics that they were on. And so, yeah, my role was sort of involving organising the data collection, and making sure patients were consented appropriately, and to slowly collect data. So we're still in the data collection phase, so haven't the whole process is going to take a bit of time, but we're in that stage at the moment. Yeah.
And are there any research projects in the pipeline? Are there any research areas that you dream that you'd like to actually undertake when you get a spare moment?
Yeah, I think, as I mentioned, I'm moving up to Cairns next year for my internship, and I am actually quite interested in tropical disease. Like, I don't have much knowledge in the area, but I did do immunology as my major for my undergraduate degree. So I've always sort of been interested in infectious disease and tropical medicine a bit. And I know that JCU up there and Cairns and Far North Queensland is like the hub for tropical disease. So I'm really keen to maybe pursue that, and also I think learn a bit more about public health and First Nations health as well. So hoping to pursue a bit more research in those areas.
So looking ahead, looking forward 10 years, where do you think medicine will take you, and what are your plans for the areas of medicine you might work in?
Or asking me the big questions here. I think, I've actually realized that you don't know where you're going to be in a year's time, let alone 10 years. If you asked me 10 years ago, would I be here? I probably would have said something completely different. Probably would have said I'd be a macadamia nut farmer.
Yeah.
So I think I would like to take things one step at a time. I imagine I will be staying in a rural or remote setting, and as someone who's really drawn to variety, I think it'll take me a little while to settle down somewhere. So I think I'll be moving around from place to place and getting a feel for different areas, learning about different cultures and different medical practices in various areas. I know it's a very vague answer, but I think I'll probably be heading down the rural generalist pathway with advanced skills maybe in women's health or pediatrics or maybe critical care. I'm not too sure yet. But in terms of what I'd like to be doing, I'd like to ensure I have a really good work-life balance as I have at the moment. I really value my sport and spending time with loved ones and, going on hikes and camping and that sort of thing. So I hope, despite wanting to really make the most of my medical career, I think it's really important to have that balance and make sure that you have that community around you, because, I feel like you can have whatever successes in the world, but you don't have your loved ones around you to share it with, it's not really worth it. So I think that's an important thing that I'd hope I have in 10 years' time.
Well, Jas, it's been great speaking with you today. Best of luck for your future career.
Thanks so much, Pat.
Thanks very much for speaking with me today.
Thank you.
And that was Jas Singh, RDAA's Medical Student of the Year for 2022. I hope you've enjoyed this podcast, and I look forward to having you tune in again. Until next time, happy days.